Hello juniors, so I welcome you all again in the continued series of lower limb, and today we'll be covering a video which is exclusively on a clinical topic, which is the foot drop. So foot drop is also known as drop foot, and this is a clinical condition characterized by difficulty in lifting the front part of the foot. And this kind of movement, the lifting the front part of the foot, is known as dorsiflexion. Showing you what is dorsiflexion. So when you flex your foot such that the sole faces the anterior towards the anterior, this is known as dorsiflexion. And when your sole faces posteriorly, this is known as plantar flexion. So an affected individual would be someone who is unable to dorsiflex his foot. So for example, when this person was asked to dorsiflex his both of the foot, he was able to dorsiflex his left foot but was unable to dorsiflex his right foot. So this inability of the foot to dorsiflex lead to a kind of state in which the leg seems like in a drop state or in a hanging state. Therefore, this condition is known as drop foot. So this condition is due to weakness or paralysis of muscle that causes dorsiflexion. This is bit obvious that the muscles which are responsible for dorsiflexion must be facing any kind of problem that would hinder them to cause dorsiflexion of the foot. So this diagram depicts the muscles responsible for dorsiflexion of foot. So this is the anterior tibialis muscle, the chief muscle. This is extensor hallucis longus muscle, and this is the extensor digitorum longus muscle. So basically any problem in the muscles which cause the dorsiflexion of the foot will finally result into the drop foot condition. And this weakness can lead to dragging of the foot while walking, which can cause the person to adopt a compensatory high steeping gait to avoid tripping. I'll show you a video of this in a minute. So in this video I have imitated how a person with foot drop walks like. So as you can see that to compensate the inability of the right foot to dorsiflex and adopting a steeper gait, that is while walking I would try to keep my right leg little bit higher as compared to left leg, so that my right leg won't drag on ground and I would not triple. So what are the various causes that result in the foot drop condition? So first of all, the nerve damage. Injury or compression of the common peroneal nerve, sciatic nerve. These two are the nerves which mainly supplies to the muscle responsible for dorsiflexion of the foot. So these nerves control the muscle that lifts the foot. So any nerve damage or neuropathy in these two nerves will lead to foot drop. Neurological disorders such as the multiple sclerosis, stroke, cerebral palsy, Guillain-Barré syndrome can affect the nerve function and muscle control. So basically these are the systemic diseases in which the body's own immune system attacks is nervous system, like in multiple sclerosis and Guillain-Barré syndrome. The body's immune system, which was supposed to attack the invaders, rather than to attack invaders, it start attacking its own nervous system and can lead to these problems. Muscular disorders like muscular dystrophy, this is a genetic condition which lead to muscle weakening and muscle wasting over the time, which can ultimately reduce the power of the muscles responsible for dorsiflexion of the foot and can lead to this condition. Lastly, spinal cord or brain diseases. The tumors, trauma, or condition affecting the spinal cord or brain can impair signals to the foot muscle. So basically any disease or any trauma to the spinal cord or brain can also lead to the condition of foot drop, because since The dorsiflexion of the foot is a voluntary movement, and any kind of disease or trauma to the spinal cord will lead to the impairment of signals to the foot muscles and can lead to this condition. And a side note for this topic is, so if you ever wanted to try this condition on yourself, then there is a hack which I have tried many times, and you can also try this and you would be able to experience this condition. So to mimic the nerve compression of the nerves which are responsible for dorsiflexion of the foot, what you have to do is you have to sit on western commode for 25 to 30 minutes, and when you will stand up you will realize that you are unable to dorsiflex the foot. So try this once, experience this condition. You will see that how your normal gait has been changed for compensation of loss of dorsiflexion. So if you found this video helpful, do like it, do share it with your friends. Thank you.